When we first were learning more about bronchiectasis several decades ago, a vicious cycle was described where there's initially an insult that leads to inflammation. That inflammation can lead to abnormal widening of the airways, which impairs the clearance of the airways. Once the airways are not clearing efficiently like they're supposed to, the mucus and the other bacteria we come across, infections can grow. And then as that cycle propagates, irreversible damage to the lungs can occur. But as we've learned more since then, and these last several years, we're learning it's more of a vicious vortex. Chronic infection can lead to inflammation, can lead to impaired ability to clear the airways effectively. It can lead to irreversible destruction of the lung tissue, but also chronic inflammation can lead to chronic infections, impair the ability to clear secretions, cause irreversible destruction of the airways, and so on and so forth, where each component will propagate the other areas of this vortex. The newest drugs that will be coming out, hopefully within the next year or so, are meant to target the chronic inflammation, so only one component of the vicious vortex. So if we minimize inflammation without addressing mucociliary clearance and having mucus stuck in our airways, we're not doing anything about the chronic infection, and we're allowing these bacteria to spend a lot of time in the lower airways, and that's still going to lead to irreversible tissue destruction and worsening bronchiectasis. So targeting one component of the vicious vortex is oftentimes not going to be enough for many symptomatic patients. And that's why it's so important to not just focus on one area of the vicious vortex, because just focusing on one and not addressing the others might slow things down a little bit, but overall would still lead ultimately to irreversible changes within the lung tissue and worsening bronchiectasis.